joining me via Skype is Dr. Kemi Odukoya, a public health specialist. Good morning, and thank you for joining us on TVC Breakfast.
Thank you. Good morning.
Now, the cases keeps rising, and of the number of cases that we have had so far, it is reported that about 113 health workers, especially from the private sector, have also been infected by the virus. How concerning is this for you?
Yeah, these are really figures that are very worrisome. Healthcare workers are at risk primarily because a significant number of people who walk into the healthcare facilities may not show signs and symptoms. So it's difficult for the healthcare workers to know when they are in contact with someone that has COVID. And that's aside from the fact that many healthcare workers are like small-scale industries. They do not have the sufficient personal protective equipment that they should have. Some of them are carrying on with business as usual. So right now we have a big problem because healthcare workers are significantly exposed, and they also serve as a channel because other patients who come in to the hospital for other reasons that are not related to COVID might actually get infected because some hospitals may serve as a focus of infection. So it's important that we have clear strategies that are directed against particularly private healthcare facilities. Private healthcare facilities managers need to understand that it can't be business as usual. We can't continue to see patients without masks or without gloves or without proper PPE. And if we don't take this seriously, we may have a big crisis on our hands with a high number. We don't even have enough healthcare workers as it is, but the few number that we have, we don't want a situation whereby they will get infected and they would either have to self-isolate or may not be around, and then we would now have a shortage of healthcare workers. We need to remember that regardless of COVID, there are other healthcare conditions that are prevalent in the community. So people are still going to have malaria, hypertension, typhoid, and all the other things. People are going to need surgeries. And we will not say because COVID exists, those people, who's going to take care of them?
All right. Let me quickly interrupt your line of thought now. You talked about clear-cut strategies. You have been following how we have been, addressing this issue as a nation. Talk to us from your assessment in terms of detection, treatment, and prevention. What would you say is working and not working?
Yes, now the federal government, they are definitely putting a lot of efforts, and they have actually reached out to private facilities. I guess the challenges that we're having is the large numbers and really getting people on board. Change is a difficult thing to sell for all of us. I mean, even for the best of people. So I think that the government is doing well because they have reached out to healthcare workers. They have started doing a whole lot of trainings. Whether that is enough is debatable, but then we can only keep at it, and we can only keep trying, and we can only keep doing what we're doing. COVID caught everybody unawares, and the idea is just to know that we need to buckle up and do whatever we can to stop the scourge of this terrible disease.
All right, Dr. Kemi Odukoya, we'll leave the conversation here now. Thank you for speaking with us. Joining me via Skype is Dr. Kemi Odukoya, an Associate Professor of Public Health. So good morning, and thank you for joining us on TVC Breakfast.
Thank you.
Now, the government is insisting, or let me use the word, the Presidential Task Force is saying that the easing of the lockdown does not mean we are flattening the curve, or doesn't mean that this is a flattening of the curve. But if we are to achieve a balance with the ease of the lockdown, how do we move from here now as a people and as the NCDC, who is at the front line of championing the directive of ensuring that we're flattening the curve?
Yeah, thank you. The first thing we need to understand is that we cannot go back to business as usual. In trying to flatten the curve, what it means that even though we have partial restrictions or partial lifting of the lockdown, we need to understand that we must, as much as possible, maintain physical distancing, even though the lockdown has been lifted. As much as possible, people need to continue to maintain respiratory etiquette and hand hygiene, and then the wearing of masks. So the government is trying to have a balance between between the economic problems and the health problems. So in going back, we need to understand that we are nowhere near flattening the curve just yet. And we need to be we need to keep our eye on those figures, particularly next week in Lagos.
So are you confident that at this point, if we put in place all of these measures, we will be able to flatten the curve?
I'm sorry, I didn't get your question properly. You were off for a bit.
Yes, I was saying that all of the measures that you have rightly pointed out, are you confident that if we do all of this, we will be able to flatten the curve? Because some persons are concerned of perhaps an increase in infections.
Well, the federal government has done something which is good, i.e., whatever policies or whatever we're doing right now, we will review within 2 weeks. I think that having a regular review, continuing to watch those numbers, watch the effect of our different policies, and being able to be flexible and adjust if need be is definitely the way to go. I must commend the Nigerian government because we've done at least comparatively well when we compare our response to some other countries. So the watchword is let's watch the numbers and let's be flexible. Yeah.
Now, we see the government saying that we are looking towards testing 2 million people in 3 months. And we see other countries testing about 100,000 persons in a day. And some other countries are, you know, employing the use of technology like drones. Shouldn't we be adopting these measures to improve the capacity to test in the country?
Yes, definitely. And one of the ways to really beat the COVID-19 scourge is test, test, test. You can find everybody who's infected and keep them away from those who are susceptible. We would end this problem. I do agree with, and the world is a global village now, so we can definitely learn lessons. Using technology would be something that would be great, particularly because Nigeria is a large and diverse country. So it might be difficult for us to meet the number we want if we go with the traditional method. So technology would help us, and I think that's something that we should be thinking about.
We see another states partnering with private bodies to also improve test their capacity to test. You see what Ogun State is doing, having drive-by testing. Should other states also perhaps cash in on strategies like that? Because if one state is doing this and the cases are clear, does that really mean every other that state is immune? Seeing the way that the virus is spreading across states?
Yeah, now the thing is, every state is unique, every population is unique. But because we are all fighting the same scourge nationally and internationally, we can learn lessons. So the idea is to look at what's working in the places where it is working and ask ourselves what can work within our setting here. And if we can find a way to have that delicate balance, it would really help us move forward with this fight, particularly in a place like Nigeria.
All right, let's leave the conversation. Dr. Kemi Odukoya, thank you for speaking with us.